Apart from that, when your WBC count goes more, it can be due to bacterial infection also. Because during winter season or even as a complication of corona or flu, you can have bacterial pneumonias. Then the blood cell count, white cell count becomes more. You get very high fever, severe chills, rigors. In that case, we have to give antibiotics wherever is needed. We can do a sputum culture and I try to isolate the bacteria and give appropriate treatment. So whenever you have fever, don't get frightened. Always try to have more water and if necessary, take paracetamol. But if any doubt, approach the hospital. That should be the first thing. Apart from the fevers, we also treat many cases of poisoning because many patients, especially young people, even for any bout of depression or following small quarrels or failure in the exam, they take various types of poison and come to our emergency. In those cases also we manage. Like very common poisonings will be insecticide poisoning, drug overdose, taking too much of sedative pills or even antihistamines, then insecticide poisoning, then cow dung powder poisoning. All these things are very common. The most important thing is try to, once the patient has these symptoms, try to induce vomiting so that poison comes out. But if they have ingested acid or alkali, better to not induce vomiting because it can cause gastric ulcers or gastric perforation. So I can try to come to the hospital as early as possible. Other emergency we see is snake bites also. Snake bites, scorpion stings, for which also you can neutralize the snake venom with anti-snake venom and treat the patient. The other most common problem in India is because general medicine caters to all the things from head to foot. In olden days, general medicine was the mother of all subjects. So we see many patients with hypertension and diabetes, which are lifestyle diseases. And many will be silent. There will be no symptoms. So when you come for other symptoms, for like fever, when we check the BP or check the blood sugar, it may be high. So treating the blood pressure and keeping the BP under control also is very important. Nowadays, the definition is the pressure should be less than 130/80. Previously, it was 140/90, but the current trend is to keep the pressure low so that you can prevent the heart attacks or strokes and other complications due to hypertension. So, very important to check your blood pressure when you come to medicine department, and if necessary, we can do further investigations and go to respective departments also. So, in the same way, diabetes mellitus also is very common. So, unless you check your blood sugar, it may not be possible to diagnose. So, in the general medicine department, we'll do the routine checking, and you can come to know about diagnosis. Because diabetes mellitus is a very common cause for even heart disease and many complications like diabetic foot. Many patients have to undergo amputations because they ignore the symptoms. So hypertension and diabetes are very common things. And with both these disorders, another common problem is high cholesterol levels. When we see 40 years people, especially ladies or gents, they become obese. And along with obesity, when you check the blood sugar or cholesterol levels will be high. And when we give treatment for cholesterol, many people, what the problem is, many people get treatment for diabetes or hypertension. After 1 week or 10 days, they stop the treatment for cholesterol or high lipids, thinking that they can control with diet. This is a very dangerous thing. And in this talk, I want to give more importance to controlling the cholesterol levels and other lipids. That is the most important thing. Along with the treatment of hypertension and diabetes, you should always try to control your high lipid levels, high cholesterol levels. And the main thing is by prevention, reducing the intake of high fatty diets and maintaining the weight by doing regular walking. Try to reduce your obesity, especially in the abdomen. Dundi, thoppa ellam paathukanum. அதுதான் ரொம்ப முக்கியமானது. Thereby you can prevent heart attack, complications of diabetes, or stroke prevention, everything. So we treat many other diseases. Maybe in the next meeting, next talk I will give you more importance.